So we have Rebekka Schnitter from the Public Health Agency of Canada to speak to us about climate change and health equity. I know some of the folks from Metro Vancouver, this is something that we're grappling with, and this is going to be of interest, I'm sure, to a number of us in the room. So Rebekka is a senior policy analyst in Public Health Agency of Canada's Infectious Disease and Climate Change Centre. Prior to working at PHAC, she worked in Health Canada's Climate Change and Innovation Bureau for 5 years, where she was co-editor of the National Climate Change and Health Assessment and a lead author of the chapter on climate change and health equity and the chapter on food safety and security. You're busy. Rebekka is currently completing her PhD at the University of Alberta's School of Public Health, where her research focuses on the intersection of climate change adaptation and health equity. So, Rebekka, over to you, please.
Thank you. Thanks everyone for sticking around for the last presentation today. It's great to be back in Vancouver at the Wall Centre. Last time I was here was February 2019, so right before the pandemic, at a conference. So it's nice to be back and not behind a screen anymore. So today I'm going to be talking about how climate change and health equity are linked and why some populations and communities experience disproportionate vulnerability, and how we can center health equity in our response to climate change to have more effective and equitable adaptation measures. Obviously, the theme today has been focused on heat and smoke in the indoor environment. So this presentation is going to be a little more high level. Some examples won't be directly related to the indoor environment, but I think the principles and the overarching concepts are applicable to everything that's been discussed today and hopefully relevant for your work. I provided a PDF instead of a PowerPoint. Great, it works. So before we get started, I wanted to note that in February 2022, Health Canada released its first comprehensive climate change and health assessment since 2008. So a lot of new research, a lot of new fields of research in this very comprehensive report. It is over 800 pages long, so just highlighting this in case there is any interest or if anyone is looking for more information on climate change and some other health risks. It also provides the latest evidence on how climate change impacts the health sector and what we know about effective adaptation actions. So I'm sure this isn't news to you, but just wanted to remind ourselves what we mean when we talk about health inequity. So health inequities are avoidable, unfair, and unjust differences in health. And in many cases, health differences are not random, but they are patterned across societies, and they're a result of how societies distribute resources, power, and opportunities, and often a result of lasting colonization and discrimination. The statistic on the slide here just illustrates this point. So we see a very different life expectancy and infant mortality rates for Inuit versus non-Indigenous Canadians. And so as you've seen in other presentations today, climate change is impacting the health of people in Canada. The WHO has indicated that it is actually the biggest public health challenge this century. Obviously, again, today we're focusing on extreme heat and smoke, but I just wanted to remind us all that there's a number of other direct and indirect climate hazards that are threatening human health. And these risks are mediated by a number of important social dynamics and characteristics. Many of these are related to determinants of health, and they can influence the magnitude and severity of health impacts that individuals experience. So climate change and health equity, they intersect in a couple different ways, and there's three kind of ways that we're seeing this discussed in research and literature to date. So first, the health risks of climate change are not distributed evenly across populations and communities, with some being disproportionately impacted, and individuals may face challenges and barriers with taking protective measures and adapting to climate change. Second, the outcomes of climate change adaptation measures may also not benefit everyone, and in some cases, they may actually inadvertently exacerbate existing health inequities. And finally, the planning and the design of climate change adaptation measures may not always be equitable in terms of their process. So important voices and perspectives may be left out of the conversation. And I'm going to get into more detail and examples of these 3 dimensions, but first it's important to remind ourselves why this is so important. So we need to consider health equity in our climate change and health activities like adaptation measures, because in the absence of these considerations, there may be some undesirable outcomes. So for example, we may overlook critical vulnerabilities and needs of those in our communities. Our actions, again, could perpetuate existing inequities, and it can also have important implications for our health system. So a study from the US found that $230 billion of direct medical care costs could have been saved between 2003 and 2006 if health disparities were eliminated. So it can be difficult to kind of conceptualize the intersection of climate change and health equity because of its complex nature. So I worked with my colleague, Dr. Peter Barry at Health Canada, to develop this framework that really helps to show where and how climate change and health equity are linked. So I'll just quickly walk through this. You'll see at the top in yellow the drivers of inequity. So these are upstream drivers that include things like social and cultural structures, so things like cisnormativity and heteronormativity, political and economic systems and structures, so political and educational institutions, for example, capitalism, and structural racism and historic and ongoing colonization. So these structures all result in the unequal distribution of money, power, and resources, and this influences the status of determinants of health. So for example, high income versus low income, high quality housing versus low quality housing. And the differential status of determinants of health creates relative disadvantages, and this gives rise to health inequities. So in many cases, the determinants of health can play a role in increasing or decreasing vulnerability to climate change. So for example, we have seen that the risk of injury during an extreme weather event is increased for individuals who live in substandard housing compared to those in quality safe housing. And of course, we see as we work through the framework that this has implications for individual health and well-being. And then the green boxes on the right, I guess they look kind of yellow here, but they indicate how the linkages between climate change, adaptation, and health equity intersect. So adaptation measures themselves can interact and impact determinants of health and influence climate change vulnerability, again, in a positive or negative way. But adaptation measures do present an opportunity to address underlying drivers of health inequity and climate change vulnerability. And this is true for adaptation measures in the health sector and also outside of it. So there's a lot at play here. I'm going to go into some details of specific parts of this framework, starting with the relationship between determinants of health and climate change vulnerability. So a couple other presentations have touched on this. Differences in exposure, sensitivity, and adaptive capacity result in some people being more severely affected by climate change. And these 3 elements, exposure, sensitivity, and adaptive capacity, make up climate change vulnerability. And so we saw in the framework in the last slide that these elements are influenced by the upstream drivers of inequity and status of determinants of health. So first, exposure, which we've talked a lot about today. Exposure to a climate hazard may differ, and this could be based on geography. So are you located in an urban heat island? Are you located on a floodplain? Communities in the north are experiencing warming at the average rate twice that of the rest of the country. So this places them on the front lines of climate change, and exposure to impacts could be greater. But exposure can also be related to determinants of health. So for example, one's working and living environments. So exposure to extreme heat could be increased for those who don't have access to air conditioning, for outdoor workers. And sensitivity to such impacts also creates differences in how people are affected by climate change. So you'll see on the slide here that people with chronic health conditions are more likely to have a serious health problem during a heat wave compared to healthy people. And finally, an individual's ability to adapt is influenced by a number of different factors, again, many directly related to determinants of health. So for example, evidence suggests that communities that have more resources are better able to adapt to climate change. And this isn't just financial resources, but things like access to information, access to technology, social cohesion. These are all things that can increase adaptive capacity. So there's a lot of different factors and elements that contribute to how one experiences climate change impacts and what influences your ability to adapt and cope to the health risks. So with that in mind, who is at highest risk of climate-related health impacts? While all individuals display some vulnerability factors to the health impacts of climate change, we have seen that that vulnerability isn't uniform. So in many cases, First Nations, Métis, and Inuit communities are on the front lines of climate change, and they're uniquely sensitive to climate change impacts, partly due to their relationship with and dependence on the environment, but also due to historic and ongoing effects of colonization and an already greater existing burden of health inequities. So the air quality chapter of the National Climate Change and Health Assessment, just as an example, found that evidence suggests First Nations, Inuit, and Métis people may face increased risk of health impacts associated with poor indoor air quality, as they commonly experience higher rates of poverty, overcrowding in homes, and poor housing quality. However, it's really important to recognize that despite these challenges, First Nations, Inuit, and Métis people have been actively observing and adapting to climate change in a diversity of ways, and Indigenous knowledge systems and practices have been really critical for their survival and resilience, and of course, really valuable for understanding and responding to climate change. So other population groups that are commonly identified as at increased risk of climate-related health impacts include seniors and children, pregnant people, people with chronic medical conditions, individuals with low socioeconomic status, and racialized populations. And then when thinking specifically about health impacts of heat and smoke in the indoor environment, might also add renters, so who may not have the ability or the financial means to modify their residence, those that live in poorly designed or poorly maintained dwellings. Also, as we saw in the last presentation, those who are unhoused or have unstable housing. Newcomers to Canada, so those who may be unfamiliar with our heat alerts and our air quality index messaging, or perhaps protective measures, information on measures aren't provided in an appropriate language. Those who are socially isolated, and people with mobility challenges, so who may have difficulty leaving their residence and seeking assistance or relief elsewhere. This is likely not news to you and very similar to the findings of the BC Heat Dome, but just kind of reiterating how differences in determinants of health and existing health inequities can really impact how one experiences health impacts from climate change and extreme heat, in this case in Montreal in 2018. So just really driving this home, this is, again, just another attempt at illustrating how various identity factors and determinants of health can really influence health outcomes related to a heat wave. So the 3 rows colored in shades of blue, these are the elements of vulnerability that we talked about, so exposure, sensitivity, and adaptive capacity. And you'll see the red row along the top indicates the health risk related to extreme heat. And you'll notice these are all different for each individual. So again, just really highlighting, and actually I should mention the red squares indicate a risk factor and the blue squares indicate a protective factor. So again, highlighting how complex climate change vulnerability is, because we all have different risk factors, we all have different protective factors, and even the health risks really differ. So I'm highlighting this because although identifying broader population groups that are at higher risk can be often helpful to inform the development of targeted protective measures or informing distribution of resources, it's really important to keep in mind that these groups are not homogeneous and that there are many differences among and within these groups, including strengths and assets that can contribute to climate resilience. And so as research continues in this field, and as the understanding of climate change vulnerability evolves, we see increasingly the importance of taking an intersectional lens to understanding climate change vulnerability. And this includes considering how multiple existing inequities can interact, shape, and compound experiences and responses to climate change. And so there's a number of tools that can help to integrate health equity into our understanding and assessment of vulnerability. And the examples on the slide, not all of them here have been designed specifically for climate change, but they can be applied to our assessments and other climate change activities and policymaking activities. So you might be familiar with health equity impact assessment and sex and gender-based analysis frameworks. So these are analytical tools that allow us to really understand how various policies or research or projects will impact health equity either in a negative or positive way. Resilience and asset mapping, that can be quite an important tool, and I think there was some discussion of this in the last presentation, but understanding, really taking a strength-based approach and working with the community to understand what people or organizations or spaces, other intangible factors that might exist and contribute to community resilience. So these are typically not captured in common forms of data. Decision makers can use this to inform where vulnerabilities still exist and where protective measures may need to be enhanced or expanded or supported. Similarly, vulnerability mapping provides information on social conditions and climate change vulnerability in a specific region. So typically these are based on social vulnerability indicators and then overlaid on a map of biophysical impacts or projected climate change effects. Vancouver Coastal Health has a good example of this, where with partners they recently developed an index mapping project, and it measures how susceptible communities are to health effects of heat, wildfire smoke, and air pollution. And looking at the map, you can see how these climate hazards really affect everyone, but disproportionately impact some neighborhoods. And so decision makers can use the map to inform the allocation of resources and prioritize the implementation of adaptation measures. And I'll go into a little more detail on community engagement in a couple slides, but really just recognizing here that meaningful and inclusive engagement with community members, particularly those disproportionately impacted, can provide very helpful information on understanding vulnerability factors in a specific region. And the chapter on health equity provides much more detail and other examples on these various tools. So once we understand what health risks a specific region is facing and who is most at risk, that can really help to inform what kinds of adaptation measures are needed. And as I mentioned before, when planning climate health adaptation measures, they really need to be centered in health equity throughout the entire planning, design, and implementation process. And this is important because, again, adaptation measures, if they're planned without consideration of health equity, the outcomes of the measures may only benefit some populations and can even inadvertently exacerbate existing inequities. So for example, urban green spaces. So we've heard a lot today about how effective they can be with reducing health risks associated with urban heat islands, and they also have a number of associated health co-benefits, but not everyone has access to green spaces. So in Toronto, for example, a recent study found that low-income and racialized communities have less access to tree canopy cover and to public green spaces compared to predominantly white communities. And so, of course, one intervention could be developing new green spaces in communities and neighborhoods that currently lack access to them. But in some cases, green spaces have also led to gentrification and increasing property values in some neighborhoods, which could lead to the displacement of low-income residents and small local businesses. So not at all saying that we shouldn't be developing green spaces, but these are just the kinds of things that we need to consider before implementing adaptation actions and ensuring that we design measures to mitigate those potential negative impacts. So in an effort to address the concerns with green spaces, adaptation plans might involve instituting rent control policies and other strategies to maintain housing affordability, again, prioritizing populations that are most in need. And so, of course, an important component of ensuring that outcomes of adaptation measures are equitable is to have equitable and inclusive participation in their design and development. And so the goal here is to really broaden the tent of engaged stakeholders and connect with populations that experience disproportionate impacts. Residents and community-based organizations have really important information that can not only help inform our understanding of climate change vulnerability in a specific region, but also what effective adaptation looks like. And in each community, effective adaptation could look different based on existing assets, based on different vulnerability factors, social conditions. There's not necessarily a one-size-fits-all approach to adaptation. And so through engaging residents, we can gain important knowledge of, again, assets and resources that are already available in the community, local and traditional knowledge, past health interventions and campaigns, so what has been successful in the past and what maybe were some challenges. And then community-based organizations can also leverage their networks to help with communication and outreach of climate change activities, especially for populations that are maybe not as involved in the design process. So a lot of emerging evidence suggesting that community-based adaptation and Indigenous-led adaptation are really extremely effective. Of course, meaningful and inclusive community engagement really requires time and resources, and so this needs to be built into the adaptation process at the forefront. So, as I mentioned before, adaptation measures, when they are planned with care, they can actually promote health equity and or strengthen determinants of good health, which can increase resilience to climate change. So, in the interest of time, I won't go through all of these examples, but one really good example of this is the Healthy Homes in Nunatsiavut project. And so this is a great example of adaptation actions that also simultaneously strengthen determinants of health. And this was a project funded by Indigenous Services Canada. They have a climate change and health adaptation program. So the aim of this project was to develop climate-resilient housing infrastructure that was also culturally relevant, affordable, energy efficient, and reduce the health impacts from overcrowded dwellings and mold. It was really collaborative. They had high community involvement in the project, and as a result, important cultural values informed the design of a prototype multi-unit climate-adapted housing development. So included in the design were things like space to store hunting equipment and a large steel sink for cleaning fish and preparing sealskins, and large open concept living spaces to allow for gathering. And this really supported traditional activities, which we know is very beneficial for health and well-being. And these were all features that were proposed by residents that were incorporated into the final design. Another example is the Nurses for Cool and Healthy Homes project. So this is a project in Fresno, California that's one of the hottest parts of the country. About 22% of the population lives in poverty, and it's a very diverse population. So racialized populations make up about 62.5% of that total population. And so they took an existing modified nurse home visit program and equipped public health nurses with knowledge and tools to help empower their clients to stay cool and healthy during extreme heat events. So they incorporated a heat risk assessment into the nurse home visits. This was a very minimal 3-minute checklist to help where nurses could assess window conditions, the presence of working air conditioners, barriers to paying utilities, that kind of thing. And based off of the responses from the client, they were able to provide information on heat illness and protective measures, and also make referrals for utility payment assistance and home energy improvement programs that were run by the city and the state. And so also just a good example of some of these measures don't have to start from scratch. We can modify, especially in public health, a lot of work that's already being done to kind of mainstream climate change considerations into them. Just some other examples. So this is a really helpful resource by the Public Health Institute in the U.S. So these are examples from a report, and they're specific to considering health equity in buildings and housing in relationship to climate change and health. So I won't go into examples. We've heard a lot of this already, things like urban greening and developing energy efficient housing. I think the primary message here is that measures to improve energy efficiency and ventilation, they could actually widen inequities depending on who the beneficiaries are. So if retrofit policies only target homeowners, for example, there's a number of people who rent, obviously, that wouldn't benefit from that. And then finally, despite our best efforts to consider health equity through adaptation processes, and even if we have community engagement and health equity impact assessments, there could still be unintended consequences or unforeseen negative impacts that result. And this is because climate change adaptation measures are relatively new still. We're starting to see efforts ramp up, but we don't have a lot of research that has monitored impacts of adaptation measures over the years. And we also don't have a lot of time, so we have to get it right, ideally, the first couple goes. And so as a result, we don't have much research that actually quantifies the impact adaptation measures will have on health equity. So evaluating climate change activities for their impact on health equity is really important, and this will help to ensure that we're not actually exacerbating inequities or negatively impacting part of the population. And it also provides really helpful information on if the measure is actually working and doing what it was designed to do and protecting who it was designed to protect. Again, the chapter on health equity in the national assessment provides some emerging tools and frameworks that can help with this. And I'll just highlight one that's on the screen here. So this is an evaluation framework that can be applied to climate change adaptation measures in any sector. And essentially, it assesses the effectiveness of adaptation measures by evaluating its effect on 7 domains that are related to determinants of health. So it uses impacts on determinants of health as a proxy for effectiveness. It also provides indicators and guiding questions to assist users in understanding the positive and negative implications of their adaptation measures. And this should really be an ongoing and iterative process. So as time goes on, you might notice that there are parts of a measure that need to be tweaked or reworked to make sure that we're really maximizing those benefits and minimizing any negative impacts. So my key messages today, health impacts of climate change are not distributed evenly. Some communities and populations are disproportionately impacted, and we saw that upstream drivers in health inequities and the status of determinants of health can play a large role in influencing individual and community climate change vulnerability. Second, climate change adaptation measures meant to protect human health are not experienced in the same way, and so some individuals and communities may face barriers to accessing and utilizing adaptation measures. Again, a lot of these barriers are often related to existing health inequities and the status of determinants of health. And so the design and implementation process of protective measures really need to be centered in health equity to ensure that benefits are provided to those most in need. And then finally, health equity can be increased and determinants of good health can be strengthened through well-planned adaptation measures. And I provided some examples of tools and resources that can be applied to assist with this. Again, just highlighting the National Climate Change and Health Assessment that provides a lot of details and other examples and case studies on this as well. So with that, I'll say thank you. This is my contact information if there's ever any questions or if you're looking for more information. So thank you.
Okay, who wants to bring us home? Roger's going to lead us off with the question.
That really is an obstacle course. Thank you, Rebekka. Great presentation. Since our session chair said Metro Vancouver would be interested in this, I felt obligated to ask a question from Metro Vancouver. So, I mean, as Metro Vancouver is doing its climate action planning and trying to incorporate equity considerations into there, how do we measure progress or success? What sort of metrics would we use? And I think part of that was in your slide about evaluation of adaptation. But, you know, are there particular metrics that we can apply specific to climate adaptation and to different groups of the population?
No, it's a great question because everyone loves to use indicators, and obviously it's a good way to measure effectiveness. And I think they will differ for each community, and I think that's where that community engagement piece really will play a big role in understanding what does effective adaptation look like and for who. And so that may be different for each group that you talk to. There are examples. There's a whole adaptation chapter in the National Assessment, and there's some examples of indicators already and other resources. The World Health Organization is very involved in climate change and health right now, and I think there's an upcoming report that will also focus on indicators and how to measure our adaptation progress. And I think I would also say, like Vancouver, I don't know if it was Metro Vancouver, but a couple years ago, I think it was to update the adaptation strategy or the climate change action strategy, and Evergreen was an NGO that they used to get information specifically on smoke and heat from populations that are commonly not included, and they got really good information that really helped inform their adaptation plan. So I don't have specific indicators for you, but I think it's a good conversation to start having with stakeholders and partners, but also with the community.
Thanks also. It was a great talk. It's going to be a question that's hard to articulate, but I would say here in BC, I don't know how other residents of BC would feel, that the discussion around adaptation in the last year has seemed to be much more akin to disaster preparedness and disaster recovery. And that's largely because the reality of RCP 8.5 is setting in. And I'm wondering at the federal government level, I mean, it seems, it's not to be cynical, but like 10 years ago, the way we'd look at adaptation, this kind of slow roll of adaptation to a changing climate we mitigate, had some hope and optimism to it. And I don't want to be pessimistic, but really there is this disaster preparedness element to it. How does this sort of now the new realities of what will actually happen to the climate kind of affect this? Because it seems like it's less about gradual changes or even tree canopies, but really flooding, Ottawa, wind that ripped through the city in an unprecedented way, those types of events, which I would imagine, as we're doing here in BC, we need to recover very quickly. We make decisions very quickly. Some communities are left behind. Some are depending on their space. I'd be grateful for your comments on that. Yeah.
Yeah, no, thank you for raising that. So, yes, adaptation, I think, historically has been underfunded, and that's because we see a lot of effort going towards mitigation. And I'm saying this globally, but it's something that I think, especially in the public health field, there's always a crisis, and there's always something that's more important, and climate change has traditionally kind of been seen as a future issue or a future problem. And so I think part of and this is where climate change communication really comes into play too. So like having decision makers understand that it's here and now, and we're seeing acute impacts like natural hazards, but also these creeping conditions, things like just general temperature change, sea level rise, that kind of thing, that we're going to need to adapt to. And this is why adaptation research is really just emerging, or we don't have a lot of information that is able to quantify impacts on health equity or to really understand what effective adaptation looks like, is because we haven't been doing it. Like you mentioned, it's been responding. And so I think like one of the main takeaways is just really making sure public health can center climate change, can apply a climate change lens to any of your activities and any of the programs that you do, and making sure that it is always centered and not just something that is done off of the side of someone's desk, or something that is kind of a future plan, because climate change is a threat multiplier. It's going to exacerbate any issue, and we've seen that with COVID, and we will, we can see in Vancouver, opioid crisis, housing crisis, climate change will make everything worse. And so centering health equity into our responses, and that could be as easy as climate change messaging. One of the resources that was on the slide has a whole section on how to just include climate change messaging into existing public health messaging. And just starting to get that conversation and making sure people are aware that, with heat events, for example, just a matter of adding a line that, and they'll continue to increase and become more severe because of climate change. So I think that's one thing to do. But yeah, I agree with you. Like there is a challenge there in terms of really putting the focus on adaptation and making sure that we're really starting to mainstream it. From a federal government perspective, I don't know if anyone's aware, but there is a national adaptation strategy process that's ongoing right now. And there's actually a web portal where it's open to the public, and you can provide any of your ideas or input into what that would look like. One of the other struggles, of course, is public health is shared over many jurisdictions. And so at the federal level, a lot of what we do is provide guidance and research, whereas provinces and territories and municipalities are really the ones on the ground who are implementing these adaptation actions. So would love to hear any of your input. I think it's called letstalkclimate.ca.
One more. We have time for others if there are others. Have a burning question in the back of the mind.
Thanks so much, Rebekka. That was a great presentation. I'm just curious, when you talked about some of the well-planned adaptation strategies to kind of prevent some of those unintended consequences for exacerbating inequities, I'm wondering, it seems like for them to be well-planned, they involve like a lot of different sectors. The groups that are putting in place green infrastructure might not have influence over, say, rent control. What is the Public Health Agency of Canada like? What's your plan for getting that message out to lots of different groups that have a role to play, like whether it's planners or people who do have influence over rent, so that people are getting that message.
Thank you for raising that, because that's a really good point that wasn't in the presentation, but a multi-sectoral collaborative approach is really necessary for mitigation and adaptation actions to climate change, particularly in health, because you saw, for example, the green spaces example, a lot of those complementary policies that need to be in place to mitigate potential negative actions are outside of the public health sector. And so collaborating with others, and it goes both ways, right? There's a lot of adaptation actions in other sectors that have direct implications on determinants of health or health inequities. So certainly collaborating and making sure that these adaptation measures aren't occurring in silos. It really has to be a kind of systems-based approach. At the federal level, the National Adaptation Strategy has included stakeholders and partners in the design process and various consultation activities. The National Climate Change and Health Assessment, one of the main findings was really promoting the importance of collaborative, multi-sectoral action on climate change work. And so hopefully spreading that message and providing mechanisms or examples of where that's been done really well will kind of inspire local level and regional health actors to do a similar thing.
Great, thanks.
Okay, that's great. Thanks very much, Rebekka.
Thank you.